Now coming to the approaches to jugular vein. You have three main approaches. One is the middle or the central approach, which is very common. Next is the anterior approach. By anterior, you mean that it is anterior to the sternocleidomastoid muscle. And the third approach is the posterior, which is posterior to sternocleidomastoid muscle. So, middle, anterior and posterior. Now, coming to the middle approach, which is the most commonest approach. Here, from the apex of the triangle, you go towards the ipsilateral nipple at an angle of 45 degrees. Next comes the anterior approach. Here, it is performed at the level of laryngeal cartilage. Here, you have to identify the laryngeal cartilage. The needle enters the medial border of sternocleidomastoid and it is directed laterally from the carotid artery. You will feel the carotid artery and go from the medial border of sternocleidomastoid and lateral to the carotid artery. You will feel the carotid artery, move the carotid artery a little bit, and from the medial aspect, you go like this and cannulate the jugular vein. That is anterior approach and it is at the level of laryngeal cartilage. Now coming to the posterior approach. Here, the most important landmark is going to be the intersection of external jugular vein with the sternocleidomastoid muscle. Here, the needle angle will be towards the sternal arch. So far, we were telling about the needle approach towards the ipsilateral nipple. But here, the needle will be towards the sternal notch. So, that is the posterior approach. The approaches to the jugular vein can also be classified as high and low approach based on the Celiard's triangle. Here you have the apex of the triangle. Low is you go below 2/3 of the triangle, that is almost near the clavicle. Here you just place your index finger and 1 centimeter lateral to the sternal notch, you puncture the jugular vein. That is quite low and here the chance of pneumothorax is very high. High approaches at the upper 2/3 of the triangle. That is what usually you do for cannulating the jugular vein. So, it can be anterior, middle or posterior approach or it can be high or low approach. Another anatomical aspect with the approach is you can take the mastoid process and the clavicle. Usually literature say you have to cannulate the jugular in between this two parts. Take the middle part. And as I said earlier, central approach is the apex of the triangle. Anterior approach is at the level of cricoid anterior to sternocleidomastoid and posterior approach is just posterior to sternocleidomastoid at the junction of external jugular vein crossing the sternocleidomastoid.